Well, good morning, everybody. My name is Alex Rabrenovich. I am the Division Manager of the Health Benefits and Wellness Division at LACERS, and this is your open enrollment meeting. This is the first of several where we're going to focus on LACERS benefits and plan changes for 2022. Any changes that you make, any changes that we discuss about plan design, those sorts of things all take effect January 1, 2022. We're going to discuss plan changes in the coming year. It's a time for you to add a dependent, change plans. If you're not already enrolled in a LACERS health plan, you can enroll in the health plan during this period, and it is from October 15th to November 15th. Again, LACERS Open Enrollment 2022. So we're going to cover some basics about open enrollment, about LACERS health plans, as well as for some changes for next year. We have a lot of positive stuff to discuss. I keep thinking year after year, at some point we're going to have some disappointing information, and it doesn't happen. We just keep having wonderful news to share with everybody. So hopefully that pattern will continue. All right. So as I mentioned earlier, open enrollment is held from October 15th to November 15th. So it's really important that if you're planning on either changing your health plan, adding a dependent, or if you're not even enrolled in the health plan yet, if you're going to enroll in the health plan, that you get your paperwork to us during this period, October 15th to November 15th. Our open enrollment packets did go out. They went out a little bit later than we intended, but I believe everybody should have received their packet by now, or they will be receiving it any day. And I do see a hand raised. The name says iPhone, so I don't know who that is, but you can go ahead and ask your question, but you have to unmute yourself.
I think it's me that's asking.
Yes.
Okay. Mm-hmm. My husband wants to possibly add Medicare Part C. That we do directly through Medicare, right? Has nothing to do with you guys.
So Medicare Part C is actually a Medicare Advantage plan. So if you enroll in one of our Medicare Advantage plans, which is SCAN, United Healthcare, Kaiser Senior Advantage, or the new Anthem Blue Cross Medicare Preferred PPO plan, those are all Medicare Advantage plans. So by signing up for those, you're basically signing up for Medicare Part C.
Okay.
You don't need to do anything through Medicare for that. Okay. There are forms that you will need to fill out related to your Medicare coverage being assigned to the plan, but you'll get those when you enroll in our plans.
Okay, of which the different plans are going to be explained within this.
Yeah, I'll give you a high-level overview of the plans, but each carrier has their own meeting scheduled. Every Tuesday and Thursday, we have a meeting focused on a particular carrier, and then on the Fridays during open enrollment, we have meetings specifically for the Anthem Medicare Preferred PPO plan, because that's a new plan that we're replacing the Medicare Supplement plan. But I'm getting it way ahead of myself, but we'll get there. We'll get there.
My question.
But yeah, if you just enroll in one of our Medicare Advantage plans, that is Medicare Part C.
Thank you.
It's kind of confusing, but hopefully I clarified that.
Thank you, you did.
Okay, great. I'm going to mute you now. Okay. All right, so as I mentioned, this is the time to make your plan changes. One thing I do want to make sure everybody is clear about is last year we extended open enrollment. We were hit with a really big project. The city was doing a special retirement incentive program, and basically our workload tripled for several months so that we could process all the retirements and related health plan enrollments. So in order to be able to accommodate everything and everybody, we extended open enrollment. So instead of it ending November 15th last year, we extended it through March of this year. And then we gave ourselves a 3-month window to process any open enrollment request that was submitted. So there were some stipulations, and one stipulation was that if you made an open enrollment request during this past open enrollment period, and it took effect on February 1st or after, you have to hold on to that change for at least a year. So you would not be able to change that change during this open enrollment period. Now, if you change your dental plan during last open enrollment period, it took effect, let's say in March or April, you can't, you won't be able to change your dental plan during this open enrollment. But if you wanted to change your medical plan, you could. It doesn't mean you can't make an open enrollment change. It just means you can't change the thing you changed last year, or actually this year, if it took effect February 1st or thereafter. Okay, so hopefully everybody's clear on that. A little confusing. Okay, next slide. Oh, there we go. So really good news. Like I said, we just continue with the good news. The good, we've just been having fantastic experience. So, as you know, medical plans are expensive. It costs a lot to cover our members, and we have about 24,000 covered lives in our plans. So there's a lot of people. The cost of our medical, dental, and vision plan premiums for the year is estimated to be, for 2022, is estimated to be $152 million. And actually that was a decrease from this year's estimated cost, which is a decrease by 1.3%. So, again, it's not often you hear that medical costs are going down, healthcare costs are going down, but somehow at LACERS, we tend to keep it pretty flat or even decrease a little bit. So we're really grateful for that. Now, that doesn't mean every plan premium decreased. It just means overall, when you add up all the premiums, then there's a decrease overall. So that's really great. And the great news is, you'd think that to get a decrease, you have to take away something or increase copay costs or something like that. But actually the opposite is the case. We actually added some really great programs. And as I sort of mentioned earlier, the Medicare Supplement plan, the Anthem Life and Health plan that we offer this year, is being replaced with the Anthem Medicare Preferred PPO plan next year. And that plan has all kinds of incredible bells and whistles, and we'll talk a little bit about that going forward. Okay. Oh, and the one thing actually, I'm getting ahead of myself even. All right. So in terms of the subsidies and medical premium reimbursement, did someone have a question? No. Okay. Regarding the 2022 medical subsidies, dental subsidies, and medical premium reimbursements, the maximum medical plan premium subsidy for 2022 is going to increase by $93.70. Currently, it's $1,790.80 a month, and it's going to increase to $1,884.50 a month. So the board has the authority to increase the maximum subsidy by the increase in the Kaiser two-party HMO premium, and that's for non-Medicare coverage. Because that premium went up by $93.70, that's what the board did. That's the most they could increase the subsidy, and typically that's what they do. Whatever the maximum amount is, that's what they'll do. They'll increase the subsidy by that amount. So again, this amount is the same for the medical premium reimbursement program maximum reimbursement. Dental subsidies for the dental PPO plan will be $44.60 a month. And for the HMO plan, it's going to be $15.10 a month. And just to note, the dental subsidy can only be applied to the retired members' coverage. It does not cover dependents, whereas the medical subsidy can be applied towards dependent coverage. All right, so the health plans that we offer. Currently, we offer Kaiser Permanente Hmo. So that's for people that do not have Medicare, that are, age 65 or under, or actually under age 65, excuse me. And then for people that are age 65 or older with Medicare Part B or Medicare Parts A and B, Kaiser offers its Senior Advantage Plan. For Anthem Blue Cross, we offer the HMO and the PPO for people that do not have Medicare, or if they only are eligible for Medicare Part B. If you're eligible for Medicare Part A, that means that you contributed towards Medicare while working for the city, and the city didn't start including Medicare contributions until 1986. So, most of you already know whether or not you have Medicare Part A. You may have also gotten Medicare Part A through a spouse, or if, after working with the city, or even before working with the city, if you had some private sector experience and contributed towards Medicare, and you did that for 10 years, or you have 40 credits or 40 quarters, whatever the terminology is that you're used to, then you would be eligible to get Medicare Part A for free. But if you don't get Medicare Part A for free, you are not required to enroll in Medicare. LACERS does not want you to have to pay that high amount. It's just not worth it. So again, if you have only Part B of Medicare, then the Anthem Blue Cross HMO and PPO are available to you. If you have both Medicare Parts A and B, then the new Medicare Preferred PPO plan will be available to you. For United Healthcare, it's a Medicare Advantage plan, also available to people with Medicare Parts A and B. And SCAN, Medicare Advantage plan, also available to those with Medicare Parts A and B. So to summarize, if you do not have Medicare, if you're under age 65, the plans available to you are Kaiser Permanente HMO or Anthem Blue Cross HMO or PPO. If you are 65 and older and you're not qualified to receive Medicare Part A for free, so you only have Medicare Part B, then the Anthem HMO, the Anthem PPO, and the Kaiser Senior Advantage Plan is available to you. And if you have Medicare Parts A and B, then the plans available to you would be the Kaiser Senior Advantage Plan, the Anthem Medicare Preferred PPO Plan, United Healthcare Medicare Advantage Plan, and the SCAN Medicare Advantage Plan. In terms of locations, Kaiser is available in California. Anthem Blue Cross HMO is available in California. The PPO and the Medicare Preferred PPO are nationwide. United Healthcare, they're available in California, Southern California, Nevada, and Arizona. And SCAN is available in California, and they recently added 2 new counties in the Bay Area, Alameda County and San Mateo County. In terms of dental, we offer the Delta Care USA HMO plan and the Delta Dental PPO plan. And then Anthem Blueview Vision is available with all of our plans. It's integrated into our medical plans, all the plans except for Kaiser. Kaiser offers its own vision benefits, but if you're in any of our other plans, you get the Anthem Blueview Vision benefits. And there are no changes to any of our other plans except for the Medicare Supplement plan being replaced by the Medicare Preferred PPO. Okay. That's a lot. I didn't think I was going to say that much about the plans, but hopefully that is clear to everybody and you know what your options are. Okay, so new programs and benefits. So Anthem Blue Cross. So as I've been saying, the Medicare Supplement plan that we currently offer is going to be replaced by the Medicare Preferred PPO plan effective January 1st, 2022. You know, sometimes a plan change can be stressful. People are concerned and wondering why we're doing it. Sometimes people are worried that you know, it's going to be a lesser plan. Maybe we're trying to save money. The amazing thing about this plan, it's like it fell from heaven or something. Seriously, we had no intention of making a plan change at all. We just have too much on our plates right now. We're so busy. And, you know, Anthem came with this amazing package and we kind of fought it initially. We're like, oh, I don't know about that. That sounds too good. Well, what about this? What about that? We were really resistant to it, but the more we looked into it, the more we asked of them and the more information they provided, the more we realized we just couldn't pass up this opportunity. And so the wonderful thing about this Medicare preferred PPO plan is, number one, the premium cost is lower. So you would think that means you're going to get less benefit, but that's not the case at all. There's actually a benefit from it being a Medicare Advantage plan. Medicare provides a subsidy to the cost of the plan, and so that helps bring the cost down. There's no deductible. So with the Medicare Supplement plan, there's a deductible that you have to pay before coverage starts for some services anyway. And you don't have to worry about that anymore. There's no co-pays, $0 co-pays, whether you're in network or out of network, the same benefits, whether you're in network or out of network. That's not something you can find easily as well. We have the same prescription drug plan that we currently offer. And then there's all kinds of special programs available attached to this plan. There's silver sneakers, of course, you're all used to that. But there's other benefits related to in-home care, transportation, meal delivery, a whole host. This is just a sampling. I do want to stress they are going to have their own specific meeting, open enrollment meeting, actually 4 of them on each Friday during open enrollment. So October 22nd, October 29th, November 5th, and November 12th. And you can use the same link that you used today to access those meetings, and Anthem will be there to answer all your questions. The one thing I want to let you know is if you currently have the Medicare Supplement plan, you will be automatically transferred over into the new Medicare preferred PPO plan. So there's nothing you need to do. If you don't think you want this for some reason, you want to change plans, or you just don't want to be in a LACERS plan anymore, call. Anthem has a number that you can call. You know, but I think the important thing is go to one of their meetings, get all your questions answered first, and then contact Anthem if you have any further questions or are uncertain. You know, and you know, you can opt out if you choose to, of course, but this seems like a wonderful plan. So hopefully you'll be able to transition with no problem, and you'll love it and write us thank you notes later. I hope so. And one other note I want to make about this is because it is available to people with only Medicare Parts A and B right now. There are people with Part B only that, you know, saw some of our communications about this plan and wanted to know if they would be able to enroll in this plan. Right now, no, but it's something that we're going to be working with Anthem on. So it's a goal of ours to make this available for people with Medicare Part B only as well. But, you know, we looked at doing that this year, but the cost impact made it not favorable this time around, but we're going to try to find a way to make it work where it works out best for not only LACERS, but its members. So hold on, and, you know, we're always trying to bring you the best. So, you know that we're working in your favor. Okay, also, you know, Anthem, of course, offers other plans as well. They have their HMO and PPO plans, and these plans, there's going to be, just talking all over myself. We are going to have an open enrollment meeting on October 26th, where Anthem will go over their HMO and PPO plans in much more detail. Okay. All right, so, I did mention some of the wonderful services offered by the new Medicare preferred PPO plan, and this is the list here. So you can see there's just all kinds of great things, right? You've got home delivered meals, personal care, emergency response system, like Life Alert, routine transportation, homemaker service, in-home caregiver relief, adult daycare, bathroom durable medical equipment, hearing aid, vision materials, excuse me, foot care. Foot care is already provided, but this actually gives you an additional 12 visits. Health and fitness tracker. So, all kinds of stuff. So it's, like I said, this plan is really something. And we're so happy to be able to offer this to our members. All right, on to Kaiser Senior or Kaiser Permanente. So there's no change in the Kaiser Permanente HMO plan for non-Medicare members, but for people that are in our Kaiser Permanente Senior Advantage plan, we are adding a meal delivery benefit. Basically, it comes into play if you've been discharged from a medical facility. It provides 3 meals a day for up to 4 weeks for a total of 84 meals a year. So this is really great if you had surgery or, were really ill and finally, were able to go home, but you're really not up to make a meal for yourself. So, and maybe whoever's at home doesn't cook very well and you'd rather have the food delivered. So, this is something that's available to you starting January 1st. For SCAN, they have all kinds of wonderful programs already. Here in the second bullet, I mentioned the Independent Living Power Program. They've got all kinds of wonderful support programs to keep you independent, staying at home. Really, it's a wonderful program. And I think that it is a good competitor to what's offered in the Anthem Medicare preferred PPO plan. So if that doesn't work for you, but you want some of those benefits, be sure to check out what's available, not only with SCAN, but all of our plans, but definitely SCAN's Independent Living Power Program is something special. And I'm not throwing shade on any other of our plans, they're all great, but just, make sure you look at everything they have to offer and see that it's right for you. But they have some new programs available in the coming year. They have caregiver training, a chronic conditions meal program, a SCAN learning communities where people can exchange ideas and thoughts, and something called Headspace, which is sort of a mindfulness program. So a SCAN, they're going to have their own open enrollment meeting on November 2nd. Again, you can just use the same link you used to access this meeting to access the SCAN meeting. Okay. Oops, I'm hitting the wrong button. Okay. United Healthcare, again, that's a Medicare Advantage HMO plan. We are adding an in-home care benefit this year for next year, effective January 1st. It provides up to 12 hours per month of in-home care. Also, a personal emergency response system is being added to their benefits. So that's really wonderful. I have my parents living here with me, and my dad's 87, my mom will be 87 in a couple weeks. And, in the past, they've actually had, before they lived with me, they had a situation, it's kind of funny, but it's not, it's cute in a weird way. But, my mom fell down, she couldn't get up. She wasn't hurt, but she couldn't get up. And then my dad was trying to help her get up and he fell. Again, he wasn't hurt either. But, he couldn't help her up and he was having trouble getting up. So he was able to crawl to the phone. They called 911. The fire department had to come out and help them both up. And they were okay and everything, but it just shows you, even if you have somebody at home, the situation might not necessarily be ideal. So having a personal emergency response system could be really useful. But to learn more about the United Healthcare Plan, they are also having their own virtual open enrollment meeting on October 28th. Again, same link that you use to access this meeting, you can use to access that meeting. And Delta. So really good news on the dental front. So Delta Dental, they have their annual maximum. It hasn't changed in a long time for the PPO plan. So again, just want to verify the Delta Dental PPO plan. The annual maximums for in-network, out-of-network haven't changed for, I want to say one was 14 years, one was 20 years, but let's just say about 15 years each. So this year, for effective January 1st, the in-network benefit is being increased from $2,000 to $2,500. The out-of-network annual maximum is increasing from $1,250 to $1,750. So that's $500 in-network and $500 out-of-network that the annual maximum is increasing. We know that teeth are important. We know dental care is expensive. Hopefully this will help you out. We really listened to all of you. We've had several meetings where people talked about the high cost of dental care. And so, we heard you. We want you to know, we can't always, do things right away, but eventually things do get to us and we are able to make a change. And so this is one we're really happy about. And so other than that, the benefits stay the same. With the plan and the dental HMO, there's no change in benefits there. For Anthem Blueview Vision, benefits will also remain the same. One thing that's changing, it doesn't really impact you, the member. It's more how we fund the plan, the vision plan. Right now, we have what's called a fully insured product. So what that means is we pay Anthem Blueview the premium amounts every month for all of our members. And from that amount, they pay the claims. So when you go to see your optometrist, they submit the claim cost. Anthem Blueview pays that. And at the end of the year, if there's a profit, Anthem Blueview keeps that. If there's a loss, then it's their loss. It doesn't really impact us. But having reviewed the financials over the years, we see that it tends to operate at more of a profit. So LACERS, starting next year, is changing to what's called a self-funding arrangement. And so what that means is that we will set the premiums. We will pay basically ourselves the premium cost, and then we will be billed the claims cost. So instead of us giving the money to Anthem Blueview paying the claims and keeping the money, we're gonna basically pay the premiums to ourselves because it's our plan now. We will get billed and pay the claim cost. And then if there's any profit left over, that stays with LACERS. And so that means that we'll have more flexibility, more control over cost, and more ability to, alter in a positive way, hopefully, plan design. So it gives us a lot more control and financial, hopefully it's a financial benefit as well. It should be. So, but again, that doesn't impact you, the member, at all. This is just transactional behind the scenes. So everything for you will remain the same. So if you are thinking about making a plan change, there are some things that you need to consider, some things to keep in mind. First of all, are you moving? If you're going to be moving in the next year, it's really important to think about what's available in your new zip code. The plan that you have now, even though, let's say you're staying within California, but you're moving to a different zip code, that plan might not serve that zip code. So you might have to change plans. So if you're looking to move somewhere, always contact us or your carrier to see whether or not they serve the zip code you're planning to move to. We've had members be very upset and very disappointed that they moved just into the next county, and there's a facility that accepts Anthem or Kaiser, whatever plan it is, just a few miles away. So they would assume that that the plan would have served that zip code that they moved to, and it didn't, and it changed their cost. It really impacted them. So again, I just have to stress that if you're planning on moving, first call LACERS, just so you know what your health plan options are and what the associated costs might be. Okay, if you are receiving regular medication, please make sure you have sufficient medication while transitioning to the new plan. It shouldn't really be a problem, but you never know. I just think it's always best to be safe and maybe get an extra refill if you can. Talk to your doctor just to have a little extra in case there's some sort of weird administrative hiccup that happens. Not saying that it will, not saying that it typically does, but where they say plan for the worst, hope for the best. So all right, coordination of care. If you're transitioning to a new plan, just make sure you're in touch with your doctor and your new health plan, just so they know what's going on. So we want to make sure that your care continues and also the billing gets done appropriately. Here's a really important one. If you are thinking of changing plans and you want to keep your doctor and your doctor accepts that new plan. So let's say you're changing from United Healthcare to SCAN, and your doctor accepts SCAN. So you're like, great, I can keep my doctor. Your doctor may not be accepting new patients. So even if they accept the new insurance plan, they may not be accepting new patients. And so just verify that, because, that would be really disappointing. You don't get to keep your doctor, and we don't want you to be disappointed. Also, just be aware of any new premium costs, any, the change in your subsidy, any deductions that you might have from your paycheck. I think overall, if you do have a premium deduction right now, it's probably not going to change, or it's even going to go down. Margaret, if she's on, she could probably confirm that or not, but basically there's no significant changes that you need to be concerned about. But definitely look in the benefits guide, and make sure you see what your cost is going to be. That's the most important thing. And finally, your new premium and subsidy and any deductions from your monthly allowance will take effect with your December paycheck. So the check that you get at the end of December will reflect your new plan. Or if you are keeping the same plan, your same plan, but the new costs associated with it. Because again, every year the subsidy changes, the premium changes. So it might impact you financially, but over 90%, well over 90%, like around 95% of the premium costs are covered by people's subsidies. And so LACERS, you with all your service to the city, you have earned a benefit that together, looking at the whole population, around 95% of the premium cost of that $150 million is covered by LACERS, by your medical subsidy. So that's really great news. One thing you can rest comfortable knowing.
Hey, Alex.
Again, everything you need to know is on the LACERS website. We have a webpage dedicated to open enrollment. You just go to lacers.org, click on retirees, and there will be a link for open enrollment. Or if you go straight to the retiree page on the left side menu, there's an open enrollment link. Again, it's got everything. It tells you about the dates of our upcoming open enrollment meetings. It's got resources from all of our carriers to give you more information about the different programs and benefits and plan designs. really everything. If you want personal assistance, you want to speak to a carrier, you can sign up for that on our website. There's a link that you click onto, you fill in some information, and we'll get back to you. We check that once a week. I just checked it the other day and noticed there were already people on there. So if you entered in something there and you haven't heard from us yet, don't worry, you'll hear from us this week. Again, just if you have any questions, reach out to us. And one last pitch. We've got wonderful staff. We've got health plan advocates on hand throughout the year. So if you have any questions, any problems, maybe you're not happy with the service you're getting from the carriers. Maybe there's a question about cost of care that you receive. Anything, just call us and we are here to help you all the time. So many members, that we talk to say, gosh, I wish I called you guys sooner. I wish I knew. Well, I'm letting you know we're here and we want you to call us. So you can reach us by phone at 800-779-8328, or you can contact us by email at lacers.help@lacers.org. For now, we're suspending in-person visits due to COVID, but we're looking to open up in a very limited capacity in the future. And that's it. I'm done, I think.
Hi, everyone. I'm Stephanie Smith, the LACERS Well Program Manager. I'm responsible for the operations and the program planning. And we also have Crystal Baldwin, which you have heard from, greeting you good morning this morning. She's responsible for the Champion Volunteer Program, as well as the event planning. We also have Betty Smith. She assists us with welcoming newly retired members. So if you're a new retiree, you may have heard from Betty or got a call from her, an email from her. And she welcomes newly retired members to our LACERS Well program. Crystal will be sharing more about the Champion program later on in the presentation. All right, so we're going to cover and explain the LACERS Well program offerings. There is a plenty to get involved with LACERS Well. We'll share with you why you should engage with the program, and we'll also tell you how you can learn more about the program. So the LACERS Well program seeks to enhance retiree quality of life by providing resources and activities to promote better health outcomes and improve your overall wellness. The program was created to work in collaboration with health plan carriers, which you see here on the Zoom call this morning, to control health care costs, resulting in savings that may be invested in programs that Alex may have mentioned, which is transportation, meal delivery, and home care, and other valuable resources for retirees. The program does promote a purposeful living campaign. We've done so for the last few years, and based on 5 elements of well-being. That's purpose, physical health, financial wellness, social engagement, and community involvement. So as you can tell by these numbers here, we offered a lot of virtual options this year. In January, we launched a health assessment purpose survey for retirees to evaluate how they're doing in various areas such as pain, movement, and functionality. Participants of that survey also answered questions in an effort to discover interests that support purposeful living. In February, retirees participated in a Kaiser Wellbeing webinar series addressing emotional well-being, cultivating mindfulness, and managing stress. During that month, we had such an enjoyable time getting to know one another, and we had fun playing a scavenger hunt game during a Valentine's Day social gathering. During the year, we invited expert clinicians, Dr. Doris, Dr. Musai, Dr. Pryor, and Dr. Fakrabadi, to give presentations on issues such as mental health and to give us COVID-19 updates. In the summer, we celebrated Mother's Day and Father's Day, and we invited the carriers to demo the virtual resources such as the Sydney Health app by Anthem and all of the wonderful website and applications offered by Silver Sneakers and Silver and Fit. All month long, you heard from Elijah here with Mom's Computer. He conducted tech classes for retirees to learn tips on their computers, their smartphones, tablets, and the internet. And that really is a popular monthly tech class. Our financial workshops, they did not disappoint. We had an overwhelming response to our financial mastery and retirement and scam series, as well as our estate planning workshops. There were almost 300 retirees in attendance. If you missed any of those workshops, you can find the recorded sessions out on the LACERS YouTube page. Our LACERS Well team, headed by our wonderful Crystal Baldwin, facilitated 3 sessions of the Aging Mastery Program. It's an evidence-based program for older adults offered in 10 classes to learn about topics such as sleep, exercise, medication management, fall prevention, advanced planning, financial fitness, healthy eating, and healthy relationships. Participants were awarded graduation certificates and incentives for their participation. The LACERS Well program also produces 2 newsletters a year promoting the Purposeful Living campaign. And as I mentioned, Crystal will be sharing about the Champion program here in the next couple of slides. So next year, the program will continue its Purposeful Living campaign based on the 5 elements of well-being, but we'll put an emphasis on physical health. We've all been sitting like we are right now for long periods of time on Zoom to stay informed and connected, which has decreased our physical activity and impacted our health and our wellness. So we intend to do something about that by really encouraging physical movement throughout 2022. So recently, in August, participants of the Fitness That Works webinar were invited to participate in a 6-week virtual fitness training class with personal trainer Sean Foy, pictured here. Participants learned burst moves to encourage movement throughout their day. Sean was so incredible at motivating participants to improve their level of activity. In fact, we had one participant that indicated that he lost some weight, and he also increased his endurance so he could run on his treadmill for longer periods of time. I'll now take a break, or have you take a break from me, and hand it over to Crystal to talk about the Champion program.
Thank you so much, Stephanie. Hey, how is everybody doing? It's so good to see you all on here. You know, as a LACERS retiree, you know, our relationship is forever. You know what I'm saying? Once you retire, you have your relationship is with us ongoing. So it's so good to see each and every one of you on here. As Stephanie stated, I'm Crystal Baldwin, Champion Program Coordinator. And basically what the LACERS Champion program does, it gives retired members an opportunity to become a champion and to work directly with the LACERS Well team. And in doing so, you will assist us with planning, coordinating, and promoting the health and well-being of our members through sharing your special skills, your hobbies, and things that you like to do, your activities, either virtually or in person. So as you can see from this slide, we've opened it up to have some in-person activities going, and we have our virtual activities. But what I want to do right now, I want to open it up to one of our fabulous champions who's on here today. She's participated in so many things, and she got this going. Nancy Council, I want to open it up to you. She is one of our lead champions, and she has 2 activities that she operates. Nancy, go ahead and unmute yourself.
I'm sending the request, Nancy. You should see it.
Yeah, she has 2 activities that are coming up that I want her to promote. For a couple minutes, Nancy.
Okay. Wednesday, November 3, we have a guided tour from a marine educator at the Cabrillo Beach Marine Park, or the park, and it will we'll be walking along a boardwalk. It's 95% ADA compliant, walking along a boardwalk, walking through past salt marshes. And we'll have a chance to actually see the tidal pools because it'll be low tide at the time we walk. There's an optional tour of optional walkthrough on your own of the aquarium afterwards. That's Wednesday, November 3, starting at 12:30 p.m. On Tuesday, November 16th, we have a monthly South Coast Botanical Garden walk at 10 a.m. and the gardens require advance reservations. The third Tuesday is free admission. It's normally $15 a person. So we want to set up for 10 a.m. on the third Tuesday of every month. The Cabrillo Beach Walk is only a one-time deal with a one-time thing with the guided with the marine educator.
Okay. Thank you so much, Nancy. And how many people do you have currently registered for your Cabrillo Beach Walk right now?
Cabrillo Beach, there's 12 of us right now. I have spots for another 10 people, 10 to 15 more people. Okay.
Oh, thank you, Nancy. That's wonderful. So
and people can bring all ages. All ages are invited on the tour.
Okay, so they can bring children, grandchildren if they want?
Yes, it's perfect for grandchildren. And if they get tired of the tour, they can go directly to the aquarium.
Okay, thank you so much for that, Nancy. I appreciate that announcement. And so if you're interested in joining Nancy and participating in that Cabrillo Beach aquarium tour, you can email the LACERS Well team or email her directly. Her information is on the website. And as you can see here, we have golfing at the Alondra Golf Course with Jimmy and Londale. That's up and going every month or every week. They have the tea time for those that want to learn golfing. And then we have hiking in Griffith Park with Ben. He just had a walk and a hiking tour just, I believe, last week. And so if you're interested in participating in any of the outdoor activities, you can go to the website and view that. We also have our virtual activities, our champions that are leading our virtual activities, Cooking with Carmen, once a month, all that's done online. We have our virtual book clubs with Janet West, Bernadette Arzu, and Jeanette Allen. That's been going on since the pandemic started, and it's up and rolling. I believe we may be posting right now with upcoming books that they're reading. We have our virtual hula class and our virtual movie review club. Every month they watch a movie, get together via Zoom, and they review the movie. Now, I just want to throw this in here as well. The program, the champion program, gives the retirees and our champions the opportunity to volunteer and assist us with special projects, also like volunteering for the phone bank. When the pandemic hit, we created, with the help of wonderful Stephanie Smith, we put together a phone bank to call and check on retired members during the pandemic. After the vaccine rollout, they were still calling, providing resources. And we're at the point now where we're going to revise the script, but we do have champions that volunteer to do that, to make phone calls, to work our call center for that. And also you can assist us with facilitating the Aging Mastery Program that we put on 3 times a year. You can volunteer to assist with that, and also at in-person activities. And one thing you need to know in becoming and volunteering to become a champion, the champions are the backbone of the wellness program, because you assist members with an array of activities and that complement their personalities, their expertise, and their professional or personal goals. So you help to get that done. And also by signing up to become a champion, we're going to provide you with the LACERS Well gear and attire, the LACERS Well swag, of course, And you will be admitted into in-person events a little early, before anyone else. So, you will get some perks for becoming a champion, and then you will be able to participate in the Passport to Health incentive program that we have, for each activity that you put on. And each activity, your participants that join you in your activity, you would go online and submit your participation in the wellness activity in order to be entered into a monthly drawing, and you can win a prize or a gift card for participating. So all you have to do, if you have something that you like to do, like to walk, it can be crocheting, whatever it is, and you want to share whatever it is you like to do with others, contact us via the LACERS Well website. Okay, back over to you, Stephanie.
Thank you so much, Crystal. That was a wonderful segue for what I'm about to talk about. So raise your hand if you've participated in any of the LACERS Well virtual offerings this year. Wonderful, wonderful. Thank you all that have raised your hand and said you've participated. Wonderful. Now, if you didn't raise your hand, you're missing out on some wonderful, really great perks of being a LACERS Well member. So this program helps you find your why. We all can live with pain, and I know we have pain, whether it's physical pain or just trouble or situations that occur in our lives. We can deal with that. It's hard to deal with that. But what we can't live without is purpose. We have to know what our purpose is. And this program helps you figure out what your purpose is. Who doesn't want to be healthy, have more energy, improve your mood, have fun building your social support team? We all need support. We can't do life by ourselves. We need people around us to help us and support us. Not to mention the information that was shared in our financial and our estate planning workshops can help you manage and protect your retirement income. You've worked many years with the city and you want to protect that investment. Most importantly, participating in LACERS Well gives you access to the best people in the world, us, the LACERS Well team. Who doesn't want to work with
right.
us? So recently, this is a great accolade. Recently, the LACERS Well program was recognized by the Business Journal, the LA Business Journal, for Outstanding Community Outreach Program. We're one of very few, and I've researched this, so it's very few retirement system wellness programs. You hear about wellness programs dealing with the active, for active employees, but very few are dedicated to retirees. So we're really proud of the work that we do, and we really enjoy making your retirement life better. That's what we are here to do, is make your life better. So how can you learn more about LACERS Well? So you can call us. These are our direct cell phone numbers here. If you want to jot them down, you can email us at lacerswell@lacers.org. You can't visit us physically right now, but you can visit and subscribe to our LACERS Well YouTube. I'm sorry, the LACERS YouTube page, where we have LACERS Well content out there, as well as join our LACERS Well Facebook group. Check out your emails the last week and the first week of each month, because LACERS Well communications are distributed during those times. Also, check your paycheck flyer for events and activities offered through LACERS Well. If you're not getting those emails, check your spam folder, or you can contact LACERS to make sure we have your most current and accurate email on file with us. You really don't want to miss out on important information shared by LACERS and the opportunities offered by LACERS Well delivered to you each month. So we have a question from Ruben. He says, how are wellness programs funded? Wonderful question. We have some wonderful representatives of the health plans here on our Zoom, on our open enrollment meeting today. They are funded by our wonderful health carrier plans. It is a health health plan funded program. And we really appreciate the support that our health plan carriers give to this program. We can't do this without them. And of course, we can't do this without you as well, participating and engaging with the program. So thank you so much, Ruben, for that question.
I raised my hand. It was in response to Crystal and Stephanie's question about who participated in those activities. That was from
that's
there.
great.
All right, so
Sorry.
y'all need to
Well,
lower
then-
your
well, then-
hands then.
Well, then
lower
I
your
have a
hands,
question for
Bernie.
you, Charlene.
All right.
What did you think about the wellness program event that you participated?
Oh, I love the wellness program. Actually, my actual name is Yaling Tam. I participated in many of the Mom's Computer by Elijah, and I won several times on those prizes. Enjoy the aging program, you know, for financial part of it, and also the activities part, the silver sneakers. You know, yeah, several of them I actually participated. So I really love LACERS program. I hope that this will continue for future years.
Awesome.
Thank you.
Thank you.
I just have a concern regarding my insurance because my husband is my dependent, and by next year I will turn 65. So is there going to be a gap in his coverage?
No. So you're currently in Kaiser, I believe you said in your
Yes.
message. Yeah. And are you planning on staying with Kaiser?
Yes.
Okay, so what will happen is when you turn 65 and you enroll in Medicare, you will, if you choose to stay with Kaiser, you would go into the Kaiser Senior Advantage plan, but your husband would stay in the Kaiser HMO plan, the current plan that you guys are in now. When he turns 65, then he would enroll in Medicare and excuse me, and then join you in the Kaiser Senior Advantage plan, but he's not going to be without coverage. And that's true with any of our plans. If you're currently in the Anthem, let's say the Anthem HMO plan, but you want to go into Scanner United Healthcare, then you would go into Scanner United Healthcare, and the person that's not Medicare eligible yet would stay in the Anthem HMO plan. If you're in the PPO plan and you want to stay in that PPO arrangement, and you or your dependent, whoever turns Medicare age first, would go into the Anthem Medicare Preferred PPO plan, and then the person that doesn't have Medicare would stay in the PPO plan until they become eligible for Medicare. So we have it worked out so that there isn't a gap when you turn age 65 at a different time. Most of us don't have the same birthday as our partner, so.
My other concern is like, is there going to be a change in premium? Am I going to have Medicare A and B?
Do you know if you have Medicare Parts A? Are you eligible for Medicare Part A?
I don't know. When do I get eligible for any?
When did you join the city?
Actually, I have 27 years with the city.
Okay, so when did you retire?
2015.
Okay, so gosh, do you know, did you start before or after 1986?
I think 1986 in March.
Oh, I think you might be right. You may have joined right before the city started contributing toward Medicare. So you may not be eligible for Medicare through the city, but you need to confirm that with Social Security. If your husband is eligible for Medicare, then you can get it through your husband. Or if you had any work outside of the city, you can then, you may be able to, you may be eligible for Medicare Part A if you have more than 40 credits or 40 quarters, basically 10 years of employment.
So for right now, I can already call Social Security to verify that.
Yeah, yeah,
Okay.
you should be able to verify that.
Okay, but then I don't have to worry with my husband not having any coverage when I turn 65.
No.
Okay.
And so if you're not eligible for Part A, you still have to enroll in Part B. And with Medicare Part B only, you would be available for the Kaiser Senior Advantage Plan. And if you currently have, I'm assuming you don't have any out-of-pocket costs for your coverage of you and your husband?
Yeah, there's no
Yes.
out of pocket. Yes.
That won't change then. That shouldn't change.
Oh, okay. All
But you
right.
can check the health benefits guide. In the back of the health benefits guide, when you get it, they have all the charts. Well, actually, I think yours will be more for the medical. It's a little bit more in the middle, but look for the deduction charts in the benefits guide and look at your years of service and go to the plan that you want to enroll in, and you'll be able to see if there's any cost. But I think you'll be okay.
Okay. All right. Thank you so much.
Sure.
Okay.
Thank you. Next, we're going to call on Gwen. Gwen, I'm going to ask you to unmute yourself. And
Okay. Thank you. You may have, I had a emergency phone call from my mother while you were, I may have to take her to the emergency room. So excuse me, a little flustered here. While you were talking, answering a question similar but slightly different than mine about turning 65 next year. Currently, my husband's a retiree, Jim McClellan, and he is on SCAN and I'm on Anthem Hmo. And my birthday is on March 27th next year, where I'll turn 65. So I understand that, I have to apply for I know I qualify for A and B. I apply a few months ahead of time, I think as early as December.
About 3 months in advance, yeah.
Okay, and my question is this, can we stay on SCAN and the Anthem HMO combination for January and February of 2022? And does it count as a qualifying event for not just me, but for both of us, since we'll both be over 65? I'm assuming my birthday is March 27th. I understand my Medicare coverage would start, is it March 1st or April 1st?
I believe it would be April 1st.
Okay, well, whichever it is, because the question would be this, I can get that clarified another time. But when I change, if we both want, is that a qualifying event for both of us? So can we change in March or April to both of us on the new Anthem Jim, would you answer that, please? Jim, answer the phone. I'm sorry.
No, that's okay. So I think I understand your question. So you want to be able to change
PPO then?
So yeah, you want to know if you can change to the Anthem Medicare Preferred PPO when you turn age 65 as a dependent, not the subscriber. So
both.
Well, he's already 65 though, right?
Yes, but he's on SCAN right now.
Right. So actually you would have to wait until the next open enrollment period. It's really based on the members, the retirees turning age 65. So you would be able to join him in his plan when you turn 65, and then you would be able to go to the Anthem Medicare Preferred PPO the following open enrollment.
So would the only way we can both be on Anthem after I turn 65 during this open enrollment period, we have to change to the dual plan?
Yeah, so you would want him to change to the Anthem Preferred PPO plan. You would go into the Anthem PPO plan. That combination is probably going to be more expensive than
very expensive.
Yeah, so that's just something for you to consider.
So it's not considered a qualifying event where you can change plans.
No, it's based on the members, the retired members turning age 65.
Okay,
so you would follow the primary subscriber.
Okay, so if we want to do it, we have to pay $750 a month with our situation for January, February, maybe March, and then it goes to zero after I'm on Medicare.
Yeah, then you would join that plan.
Okay.
So I guess if you do the math,
it's not
figure
nice.
out which situation works better for you. The math, the money versus the benefits of the plan and
and then what happens, because with the Anthem PPO before I'm 65, there's a deductible And so I'd be paying my deductible, paying the extra cost and probably not getting any coverage during the time that we're paying the high premiums. Anyway, I guess that's the way it works.
Yeah, I'm
Bad.
sorry. Yeah. Well, you have options. So at least there are options.
Well,
So
and the most important thing was knowing what the options are and not misunderstanding them. So thank
yeah,
you for
absolutely.
clarifying that.
Absolutely.
Okay, thank you.
Yeah,
I want to know, I haven't received the open enrollment package and today is already 19. So just trying to see when
yeah, give it a couple more days. Where do you live?
in Los Angeles.
Oh, really? Okay. So you know what? Let me write down your name. So Tsun Kwan, is that the name of the
No.
retired member?
I think you're talking to Akimani right now.
Hello?
Yeah, you're talking to Kimani.
Oh, I'm sorry. I'm sorry. Okay.
Amin Kimani.
You're right next to each other on my screen, and I thought I saw the other box light up. Okay. Could you tell me your name then? How we have it on record?
Amin, A-M-I-N.
Uh-huh.
Last name K-H-I-M-A-N-I.
Come on. Okay. I will go ahead and look into that for you. They did go out later than intended. We had some issues with the production of the file for the statement that's included in the packet. And so it got delayed a little bit, but we'll look into it to make sure you were on the mailing list. And if not, we'll make sure you get the information.
Okay,
sent to you.
now, the home health, when you talk, all this, the whole seminar I was listening for Medicare people, is it also available for people who are under 65?
Which plan?
Anthem HMO.
So for under 65, we have the Anthem HMO, the Anthem PPO, and then Kaiser HMO. Now, the plan that I talked about, the new plan, the Anthem Medicare Preferred PPO, that's only for people with Medicare Parts A and B, if that's what you were interested in. But in terms of being non-Medicare, again, it's those three plans, the Anthem HMO, the Anthem PPO, and the Kaiser HMO.
So will Anthem HMO cover home health?
I'm not 100% sure right off the top of my head what they cover. I know we have some Anthem reps on the call here. So Raymond or someone else, can you talk about what's available in terms of home health for Anthem HMO?
Yes, there is coverage for home health, limit to 100 visits per calendar year. So there is coverage. And under the HMO plan, services, of course, needs to be approved ahead of time for medical necessity. But there is coverage up to 100 visits per year.
So if your primary care recommends it, then it's available.
We will review it for medical necessity to determine how many days is required or needed for the home health. And once we determine medical necessity, then it will be covered.
Okay. All right. Thank you so much.
You're very welcome.
I'm over age 65. Hello?
Yes, we hear you.
Yes.
I'm currently I'm in Kaiser. Now I have to, I would like to change my plan. One of my choice is with my wife. And her health insurance is covered by the UCLA. So I will become the dependent of my wife. My question is, I still can covered by the viewers or benefit.
Did you want to know if you can stay enrolled in LACERS plan and be enrolled in your wife's plan?
Yes.
No, if it's a Medicare plan, you can't do that because Medicare only allows you to assign the benefits to one plan. So if you like stay in LACERS and you also enroll in her plan and it's a Medicare plan, you're going to have to assign your Medicare to that plan. And then Medicare will alert us or Kaiser, and then you'll be canceled. So, you can't have coverage in two Medicare plans at the same time.
All right, thank you.
Sure.
Few questions.
Yes.
First of all, right now I'm in Medicare Part A and Part B already, and I have Anthem Blue Cross PPO. So I think next year I would like to enroll in Medicare Preferred PPO. Is it good for me? Is it good for me, right?
Yeah. So you currently have Part A and B?
Yes.
And you're enrolled in, so then you're enrolled in the Anthem Medicare Supplement plan, the life and health plan. Yeah, so you will be automatically transitioned over to the new Anthem Preferred PPO plan, Medicare Preferred PPO plan, effective January 1st. So there's nothing you need to do if you want to stay in this plan. If you decide you want something different, then you need to reach out to Anthem, and we provided information about that in our mailings.
So I repeat one more time. It means I don't have to do anything.
No.
Just pay only.
Yeah, just wait.
So may I ask another question is, right now my doctor is in UCLA group. So if I go to Medicare Preferred PPO plan, do I still have to see my doctor or I have to do anything?
So
I was going to take
ahead,
that
Tammy.
one.
Go ahead.
Yeah. So actually with the Anthem Medicare Preferred PPO, it is in and out of network. UCLA is actually in network, so you don't have to worry about that. But it does offer the nationwide coverage for in and out of network providers who accept Medicare.
Okay, thank you so much. Thank you. I may ask another question. I would like to know the difference between Medicare Part A, Part B, and Anthem Blue Cross PPO, and the new one is a Medicare Preferred PPO. What's the difference?
So the difference between the Medicare Supplement plan and the new Medicare.
The difference between my current plan and the new plan is a Medicare Preferred PPO.
Well, I'll jump in and say something, and Tammy, if I leave something important out, you can add.
Yes, please. The only important thing. I will read.
Well, number one, with your current plan, there's a deductible you need to pay. You don't have to pay that with the Anthem Medicare Preferred PPO plan. Also, with the Medicare Supplement plan, it's what's called the Medicare Supplement. The supplement plan is a second payer program. So basically, when you go to a doctor, they first bill Medicare. Medicare will, pay whatever portion it covers, and then the balance will get billed to Anthem. So it's a longer payment process for the provider. This plan is a Medicare Advantage plan. So basically, Medicare pays Anthem to handle all the claims. So it doesn't have to go to Medicare first, and then whatever is left over goes to Anthem. Now everything goes to Anthem, and Anthem just takes care of it. So it's a more efficient way to pay the provider. The biggest difference is the price. It's a huge difference in price. I want to say it's like I don't want to overstate it without looking at the numbers, but it's a big difference. It's a big reduction in the premium cost, which is wonderful for everybody all around. And then again, there are all those wonderful programs that I showed you earlier. Some of them are in the Medicare Supplement plan that you currently have, but the Medicare Preferred PPO plan offers many more wonderful support programs. So there might be something I missed there, Tammy.
You got it, Alex. That you said it perfectly. So thank you.
Awesome. Thank you.
Thank you. Thank you so much. And I know because I just got the enrollment plan, I think next year I have to pay only over $49 per month. Before that, I had to pay $56. Yeah.
All right.
Yeah. One thing.
It's a little bit of a difference, a little bit of savings, but it adds up, right?
So no, for me, when I retire, really different. Another one is I still have to pay Medicare for Part B. Right now, I have to pay $148. I know next year I have to pay more, but I still have to pay that part. Is it correct?
Yeah. So that, Medicare, unfortunately, Medicare Part B isn't free. Everybody has to pay the premium out of pocket. However, if you do have Medicare Parts A and B, the plans that we can offer to members with Parts A and B are so much cheaper than the plans that do not have Medicare Part A. So there is a benefit that reimburses members with Parts A and B the basic Medicare Part B premium cost. Some people, depending on the income that they earn or they make or they receive, depending on their income, they might actually pay more than that $148.50. That's the basic premium. But if you make more than that, there are additional premium charges that you might be assessed. And I know people who pay those know very well that they pay those, but we don't reimburse those additional costs, just the basic cost. And if there is any Part B penalties, if you enrolled in Medicare Part B late, Medicare does assess a lifetime penalty, and we do not reimburse those either. So that's why it's really important when you turn 65 to enroll in Medicare, because there are lifetime penalties that can be added to your cost later when you do enroll.
Yeah, thank you so much. First of all, I really appreciate for all your answer and from my heart.
Sure.
I'm very happy right now because I was city employee, and right now all of you take care of my rest of my life. I really appreciate it. Thank you so much.
I think you're welcome. And that's what gives us purpose every day. I really want to, express this to all of you that, you're not just a number to us. I mean, well, maybe a little bit because there's so many of you. We can't possibly know each and every one of you, but every number, every name, every face, everybody is so important to us. And we really do our best to take care of all of you, because you know what, we're going to be in the same position. Actually, me in a couple months, I'll be a retiree.
I'm sorry,
so,
may I ask one more question? I'm sorry. How about the drug? Do I have to pay anything for the Part D?
Part D is integrated into the cost of our plan. So, when you pay your premium, that involves the Part D, like drug premium. So you don't have to pay separately for that. However, similar to Medicare Part B, if you make over a certain amount, there are additional premium charges that you get assessed, and those are not included in our premium. So Medicare will bill those, or Social Security will bill those separately.
Yeah, okay, thank you. I really appreciate it. Thank you so much.
Sure. But
you.
really, I do want to state that, we really do our best to make sure all of you are taken care of. The wellness program is a really important passion project of ours that, our goal is to really give you the best retirement possible, just to stay healthy, to stay socially connected, to have resources available to you. And then in terms of your plan benefits, we do our best to give you, really competitive rates and really great coverage. And as you've seen over the last few years, we keep adding and changing in your favor. So just know we're here for you.
Thank you, Alex. Our next questioner is Les Amer.
Thank you. I want to ask, I currently have the Medicare Advantage HMO, and I'm planning to change next year to, I don't know what you probably call Medicare, regular Medicare or straight Medicare. I'm not sure what the proper terminology is if it's not Medicare Advantage.
Okay, so, well, in terms of our plan offerings for, anybody with Medicare Part A and B, they're all Medicare Advantage plans effective next year. So if you're not going to enroll in a Medicare Advantage plan, does that mean you're not going to enroll in one of our plans?
Well, I guess that's the question then, since I want to be on, I guess, full Medicare with a Medicare Supplement plan, does that mean I'm not with Medicare Advantage anymore?
Well, yeah, I mean, because the Medicare Supplement plan that we currently offer, or any Medicare Supplement plan is not a Medicare Advantage plan. Okay. So, basically it supplements Medicare. So as I mentioned earlier, when you would see a doctor, they would bill Medicare, provided the doctor accepts Medicare, they will bill Medicare and Medicare will pay them the agreed amount for that service. And then whatever's left over would go to the supplement plan, whether it be Anthem or some other carrier, and then they would pay the difference. If for some reason the doctor doesn't accept Medicare, you might have some out-of-pocket costs that you have to deal with. So it's always better to make sure they accept Medicare. But yeah, so it works differently. But we're not going to have a Medicare supplement plan effective next year. So if that's what you're looking for, then you'll want to, you'll want to disenroll from our plan. But if you want to stay with us, then we do not have a Medicare supplement option. Unfortunately, it's, well, I think fortunately, because what we're offering in its place is just so much better in terms of support. And it's even better for the provider because, again, as I mentioned earlier, you don't have this sort of two-phased payment to the provider. It's like they just, bill Anthem and Anthem covers it, all of it. So, there's no co-pays, there's in and out of network benefits are the same. There's no deductible. The only thing that might sound a little negative that's different is that you may require pre-authorization for certain services, which means, they have to go to Anthem and they have to approve it before you can move on. But, to me, that's always something that we consider. But, my parents, they have an Anthem Medicare Advantage plan right now. And, oftentimes their specialist will want, to have a certain, service provided, whether it be like a CAT scan or physical therapy or something. And honestly, it goes through Anthem really quickly. Nothing's ever been denied. I mean, I can't promise that for you for everything, but my experience has been that it hasn't really been an obstacle. It hasn't, they've gotten all the care that they've needed. So, I'm just throwing that out there, but obviously you have to do what's most comfortable for you. I just want to make sure that LACERS will no longer have a Medicare supplement option. We only have Medicare Advantage options. So, if that's what you're looking for, you might have to go outside of LACERS then, and then you wouldn't be eligible for your subsidy, most likely. Do you live in California?
Yes, I do.
Yeah, so, you wouldn't be able to have access to your subsidy then.
Or he wouldn't be no longer receiving the Medicare Part B reimbursement if he gets that.
Oh, that's true too.
Yeah.
Okay, well then again, just for terminology's sake, so if I do the Anthem Medicare Preferred PPO plan, that is a full Medicare plan. There's no need for a supplement to that, right?
Absolutely, you've got it.
Okay, so the main question then is, do I have a problem in getting doctors to accept that full PPO plan?
there should not be a problem. So as long as you stay in the Anthem network, the doctors have to accept the plan. If you go outside the Anthem network, as long as they accept Medicare, they should accept this plan. If there's any question from a provider about it, you can have them reach out to Anthem or let us know, and we'll have Anthem reach out to them, because sometimes people maybe don't understand how the plan works. But again, I think it would be silly of them not to, because it's a much more efficient way to get paid. You know, they just go into one entity versus having to go to Medicare and then to the insurance carrier. They're going to get paid a lot faster. But you know, that was one of the concerns that we had before making the decision to switch to this plan. So, you know, we asked Anthem to do an analysis of all the claims that had been submitted to see, you know, how many were out of network and were there any issues in payment. And I want to say like 98.7 or something like just barely under 100% were actually of out-of-network claims were paid by Anthem, meaning that if everybody's going to the same doctors that they've been going to, there shouldn't be an issue because they're already working with Anthem.
Yeah. You know, again, what I had heard for a couple of years before I retired was the main issue with Medicare in general was that because of the reimbursement rates, a number of doctors did not want to accept Medicare patients. And I wasn't sure how much of an issue that was going to be.
Yeah, I mean, even with the Medicare Supplement plan, you know, they need to accept Medicare because that's who's going to pay them. You know,
Yeah, I know.
So you know, and I know there had been some issues with that in the past. I think especially when the ACA, the Affordable Care Act, went into effect, there seemed to be a lot of confusion and concerns from doctors. And I think Medicare was also saying they were going to start paying less, and there was all kinds of uproar, but I haven't really noticed any major changes. I don't know, Tammy, do you have anything more to add to that?
Yeah, I just want to make sure that with the Anthem Medicare Preferred PPO, even if the provider is out of network, they're getting 100% of reimbursement for the Medicare allowable. A few things to note is that you should never pay. If some doctors will either charge or pay or ask you to pay over Medicare allowable. That's not legal. Then once again, we have our customer care to help you with that if you have any questions. But it's also important to note, you're only allowed to be enrolled in one Medicare plan at a time. So you always go through LACERS. So don't get caught up in those TV commercials where they say $0 this and $0 that. If you enroll into any plan outside of LACERS, it's going to cancel your LACERS plan. So important to note on that. But as far as Medicare doctors, there's about 2% in the entire United States that choose not to. They opt out of Medicare, and those are usually your psychiatrists and your like dental that opt out. So you should be fine. Anybody who takes the Medicare supplement, like Alex mentioned, 98% of the doctors in the Anthem network. So you should be fine.
Okay, thank you all very much.
Sure, you're welcome. Thanks for your questions. They're really good.
I currently have the Anthem PPO, and my understanding is that I will be shifted over to the new plan PPO. I have several specialists and I have primary care. Do I just continue to go with them, or do I have to do anything actual on my part?
Well, what you should do, what everybody should do, is when you get your new ID card, you're going to show that to your doctor, because now instead of billing Medicare first and Anthem, they're going to bill Anthem at one time. They're already familiar with our system Ability. Most in-network providers they need to use that. It's kind of an electronic submission. So just make sure you show them your new card.
Okay.
And that's true for everybody, you know, that's, you know, I would say even before you get your card, if you know you're going to be going into this plan, contact your providers and say, hey, you know what, effective January 1st, I'm going to be going into this new plan, the Anthem Medicare Preferred PPO. it's a Medicare Advantage PPO plan. You know, and just to ensure that they do accept it, that they are familiar with it, because if there's any problems at all, we would rather you let us know or let Anthem know in advance so we can resolve those. There shouldn't be an issue in the transition, but you know, sometimes there are questions or maybe a provider is not as familiar. So we just want to make sure that we try to, you know, nip it in the bud. We don't want you to be in full bloom.
And
So-
Alex, on that note too, I put in the chat box, it's a, we have a microsite specifically dedicated to the Anthem Medicare Preferred PPO, and it's www.anthem.com/CA/LACERS wellness. And so on that website, there is actually an out-of-network flyer that you can use. Or you can either print it out or show your doctor that it kind of explains what to do if they're out of network and they want to accept the plan.
Okay, I've got one additional question. Is that I'm used, and I don't know the practicality anymore. I also have TRICARE. And beforehand, I would give my doctors my Medicare card, my Anthem Blue Cross for supplemental, and my TRICARE. If nothing was picked up by the first two, my third would always pick up. So do I still give now only the Anthem PPO new card and also TRICARE just in case there's a fail-safe for anything that may drip over?
So you have TRICARE for life?
Yes.
Okay. Actually, that's an excellent program, but if you're going to enroll into that Medicare plan, then yeah, show them both cards and they'll work out which one pays first.
Okay, so just give it to the doctor and same concept, instead of 3 cards, it's 2 cards.
Yes, actually, and that goes for everybody. If you actually were in the Anthem Medicare supplement, you put that red, white, and blue card away. You don't have to use that anymore. So put that in a safe place and you're going to get a new ID card that covers you for your prescriptions and your medical as well.
Thank you.
Yeah, and along those lines, so not only will you be getting a new card for the Anthem Medicare Preferred PPO plan, which will cover both medical and prescription. But if you recall, when I was speaking about the vision plan, how we're changing the way we're funding it, like moving to a self-funded plan, because we're doing that, again, the plan and the benefits are all going to be the same, but because we're funding it differently, it's like a new plan. So we are going to be issuing new vision cards out to everybody. So just so you know.
Hi, good morning, Alex. Good
Hi.
morning, everybody. I just have a couple of questions. Actually, one is common. I think is one person was asking about once reached 65, the premium. I think Alex is correct, but the one caveat is I think everybody also know about it is depend on your income. I think if your income higher, your obligation to pay for medical, not co-payment, but a premium every month. This is not paying to the specific carrier, but it just, to actually it's federal, it's government, so the fee will be quite high. So that based on your income, I think I've been trying to pushing explore more for this kind of a knowledge to the the retiree, because a lot of time when it hit, then it's very painful. It's after tax money. It's not really pre-tax. And I think at last time when I joined, I think LACERS is one of the Stephanie there, right? It's one of less program other a government entity when a retiree retire have this kind of program in place to helping us, assisting us in living well. Basic, more healthy, more alert. What's going on networking. It's a very good program. I think we should continue with this. I think it's very good program to go with it. Now, last time I joined the financial planning. I joined a lot of activity, and I think that one is very helpful for a lot of retirees to set up not only while you're living, but also after you're passing and how you're going to create less stress or pressure for your, family. And that's very good piece of information there. But I will request, if possible, I think bad news is hard to, bury in there. But, once we hit 65, I noticed myself, I still a few years ago, but I really don't feel like it to reach 65, be very honest with you, because it's going to be big financial burden for certain people. And I know a lot of people will say, well, you got to be grateful. Which I am. I'm grateful is what I have, but in the same token is you need to be mentally and financially, you need to make sure you are, cut back, because that would be the normal, expenses for your monthly expenses. And a lot of people do not aware of that. And it's not, some of them is not cheap, especially if you're single, it's very, very high, deductible. I think you might want to look into it. I mean, the medical Part B is quite going to be, hit you quite a lot. So that way, if you are doing your financial planning or you're doing your monthly expenses, those need to be in place, so it won't be hit you by surprise. That's a common, I have a first one. And second one is, Alex, I think last year they've been talking about for retiree before reaches 65, we retire before 65. And of course, it's our medical and the dental have a lot of good coverage, and which is now city actually is paying our retirement contribution. City is also contribute, and they have a talk about it, going to cut back the benefit. And I know it's a talk, but it also scare a lot of retiree, especially like me, before 65, I would keep very close eye on it. I know city is financial, challenge, but in the same token, our retiree, please keep us informed, because I don't hear anything about, I know you don't want to create unnecessary stress for the retiree, but in the same token, generally let the retire, we don't want to be in the dark, because I find out from someone told me, say, well, oh, Faye, do you know this is going in the council? Then I got to be starting look into it. And that's going to be an impact for the retiree before 65, especially if your family need to cover it, and you need to be careful with that. And I do not know what the progress with it. I know it's kind of slowed down because so many problems with city now. So they might be back in their burn, but I hope that would keep us, in a loop on that one too.
So Faith, I have a couple responses. First of all, thank you. Yeah, one thing, that Faith talks with me about, and something we look into, is the Medicare Part B premium. So as I mentioned earlier, there is the basic premium, and if you have Parts A and B, we're able to reimburse the basic premium. But if you make over, I want to say, if you're, it all depends on whether you file for taxes single or head of household or jointly. But if you file single, I want to say it's around like $88,000. If your income is greater than $88,000, then you're going to start to be assessed additional premium costs. And the more and there's different tiers. And so if you make a lot of money, you're going to pay quite a bit for your Part B premium. And, it's not fair to say, well, if you're paying that high premium, it means you're making a lot of money. So what are you complaining about? But, people have various, responsibilities and obligations. Like, we don't know how people, what their financial situation is, regardless of how much they make. And so it can be a burden. And one thing I want to say about that is in the next couple weeks, if you are receiving a Part B reimbursement, we are doing a survey, and we want to know what your full Part B premium is, because we only know what the basic premium is. And it's just a real simple questionnaire, 3 questions. You don't have to even put your name on the response. We're going to give you an identifier that you can put in, whether just verifying that you receive a Part B reimbursement, and then for you to indicate what the amount is. And once we hear back from everybody, we'll be able to present that to the city and say, look, this is what our members are dealing with, and they can possibly, you know, we don't make the benefits, we just administer them. The city unions and the city management, they negotiate, they come up with the benefits. You know, we don't really get to tell them what to do, but we can provide them information. So we're going to take that information and provide it to them. And who knows, maybe if we're lucky, they'll be willing to allow some reimbursement of some of those additional costs. But, you know, I can't promise anything. It's just something we're, you know, at least we're going to inform them about what the situation is for our members. And then in terms of the second comment, Faith, that you made, yeah, there were a couple recent council motions to explore other means of providing healthcare, such as going to the healthcare exchange or using health savings accounts. But we prepare these extensive reports and provide them back to the city administrative officer, basically detailing why that wouldn't make sense. I mean, LACERS performs so well. Our health benefits are so cost effective. The assumed actuarial medical trend, you know, rate is around like 7. Oh gosh, sorry. Dog.
I have a dog at home too.
This one, he's like, I know you all heard him earlier. He drives me crazy. But anyway, anyways, but you know, we outline everything that we do, how we manage our costs. When you look at the 10-year average assumed actual medical trend rate, which is what the city bases its budget on, we're half of that. Our actual trend is half, less than half sometimes than that. And so we're performing very well. And then when you compare our rates and our benefits, the coverage that we offer, the plan benefits, to what's offered in the exchanges, our benefits are somewhere between gold and platinum level, but our cost is either similar or lower, and their costs are going up at a higher rate than our costs. So it doesn't make sense to change. And as for the health savings accounts, that's only available to people under 65. The majority of our members are 65 or older. So that doesn't make sense either. So there's always going to be people out there trying to find ways to save money. You know, they think they know better, they hear something and they want to throw it out there. But at the end of the day, we're an independent department. We don't answer to city council. We don't answer to the mayor. We have our own independent board that makes their own decisions. And although the mayor does appoint some of our board members, we are independent, and there is no inclination of us changing what we're doing anytime now or in the near future. Hopefully that doesn't change. And if it does, hopefully it's only for something even better. But I want to reassure you that we are doing such a darn good job with our health plans, our health benefits, that the city would be silly to change anything on this end.
Thank you, Alex. I'm glad to hear that, you know, for the information. I think a lot of time, that's why it's keep the senior healthy is very important, because that would cut down our medical premium. And I think as you guys do such a good job, you know, I seriously, you know, I mean, City of LA, you know, we work very hard while we are working, but when we retire, I'm glad, just like other member also greatly appreciated what you guys doing, because we're taking care of each other. Basically, the employment we have is like, you know, for lifetime. You know, we contribute what we have while we are young, and we fulfill what we are committed to. Once we retire, we want to take care of it also. So I'm really glad you guys have this, you know, wellness program. You know, you listen to what a member were talking about. All we're asking is try. And then if work is fine. If not working, at least we ask. Does not mean we are silent group and nobody care and just kick us aside and life go on. And that's a comment I want to make. But I also have one question about the enrollment, you know, question between, I saw this Anthem Medicare Preferred is very good. And they have a lot of, I think it's work toward to the senior need, you know, a lot of home care. I look at it is, instead of regular young people, you know, I mean, you get sick, that's why you go to hospital. But you are now looking more with the aging process, you might need some help at home. So I see this is a very good program. Now, the question I have is currently I do have a Kaiser. Of course, I'm not 65 yet, but like I say, I'm not looking forward to be 65. But one way or the other, I need to face in the music, but I want to prepare myself. I look at it, say, like they have a couple of the item, Anthem has, it's like some of them, they have the limit. Some of them, they did not have any indication of what kind of limit, maximum amount they have, or maximum time they allow. Such an example like home services. They did not say how many times they can request for home services. Or in home care, caregiver relief. What kind, how often they have. I know this is also not offered by some of the, maybe they have similar plan, but not there. I hope eventually every single plan we have, include Kaiser senior plan, senior advantage plan, they all can go in. I know Kaiser have a lot of good plan. I know I saw it happen with my own family when they go through a illness and they do take good care of you. But I also want to know, but I did not aware they have like home care, the caregiver, relief. This is a very important element. Like, for example, like home service, homemaker services, this is very good also, like assistant light, cleaning, grocery shopping, this is very good. But the question I have asking is, do they have a limit? Because it's also, this can be married in with your long-term care. If some people buying the long-term care is really necessary, especially now we're getting older, those long-term care is not very easy to obtain it or very expensive. So if you guys, next time if you open it, maybe they already have program, I just do not know, or if you can give me some clarification, I would greatly appreciate it.
So, I think the Anthem Medicare Preferred PPO and even SCAN, they kind of have a larger stable of programs to help keep you well, keep you at home, keep you independent. We're slowly adding other benefits to help provide support, like again, with Kaiser, we're adding the meal delivery, and with UHC, we've added the life alert and the in-home care, but they still don't compare to what's being offered with the Anthem Medicare Preferred PPO and even SCAN. So, our goal is to get everybody up there. That's what we want. And, honestly, strategically, and if our health plans are listening, we're going to use that going forward. This is what we want. This is what we expect, and so, we're moving in that direction, and we don't want to turn back. And they know that that's important to us. And, that's why we're seeing a lot of these coming in, maybe some more gradual than others, but also, the baby boomers are retiring. There's a huge wave of retirees coming in, and we need to, as a society, we need to grapple with that. We need to provide support. We need to be able to help, because honestly, I don't think the medical industry can tackle it all on their own, and families are, stretched thin as well. So these support programs are super important.
Yeah. And can I ask you, is the Kaiser now they have a live alert program? I look at most of the program, they have live alert program, like very good, like Anthem Hmo has it. I think United Health has.
They're adding it.
Yeah, and so I do not know if Kaiser has it or not.
I don't think we have that yet with Kaiser. We ask every year when we go out to bid or when we do our renewals, we ask for certain things, and they come back with some of the things. Things don't always happen at the same time with all the plans, but we keep at it, and eventually we tend to get what we ask for. It just takes, it's like the drip system. You have to keep annoying them to the point, where we can actually get it included, or until maybe enough people have asked about it that they actually start to include it. Yeah, I don't think it's part of this senior plan yet.
The live alert system, they just set up the system in your home, right? They provide you a system in your home. Is that live alert system all about?
That's what I understand. Yeah, and definitely, if it's kind of like I've fallen and I can't get up, that commercial, it's one of those sort of things where there's like a little button you could press if you need help with something. However, I don't know all the details about it. So definitely, if you're interested, you could attend maybe the UHC
Yeah, I will.
presentation or the Anthem Medicare Preferred PPO meetings, and they can give more information about what those are.
All right. Thank you so much, Alex. Nice
Sure, thank
talking to you.
Kate.
Thank
Yeah,
you.
nice talking to you.
You indicated earlier about, you, there was talk, I guess, about perhaps removing or deleting the Part B basic reimbursement to us. So if the council or others are talking about removing that from our benefits, then I guess the talk about getting Part D and Part B IRMA reimbursements is further down the line, a lower priority, right?
Well, no, let me correct that. No, there may have been a misunderstanding. We are not going to get rid of or eliminate the Part B premium reimbursement. Right now we only offer reimbursement of the basic Part B premium, but we're looking to actually inform the city of what our members' real out-of-pocket cost is for Part B, so that they can reconsider, maybe allowing for reimbursement of IRMAs to some degree. We don't know if that will be successful or not. But there's no inclination that the Part B premium reimbursement program is going to be eliminated. That's in there. It's in the administrative code. So
oh, terrific then. And so does your I guess IRMAs tend to hit us when we end up at this point now hitting 72, when we will have to pay RMDs, required minimum distributions, and that increases our annual income. And then for the most part, that's when the IRMAs really will kick in and take you to the next level. Whether you're already paying IRMA now, you'll be paying a higher level of IRMAs. If you're paying only basic, you'll be starting to pay the IRMAs. So does your survey, should your survey then include what we would end up paying for Part B next year? Because I turn 72 next year, and I know I'll be paying required minimum distributions next year, and I know I'll be hitting the IRMAs, another higher level up of IRMAs. So if you really want if you're looking at what we're going to do in 2022, maybe adding an extra year. What do you think you're going to be paying next year?
Well, we don't know. Yeah, we don't know. We don't know what the premiums are for next year yet. And, definitely there are people currently that are 72 or older who are receiving their RMDs, their distributions and addition. So hopefully that will all, inform the results.
Okay.
So yeah, it's a personal goal of mine to get this done before the end of the year. It's like a personal project of mine. So yeah.
And if one has a dependent that has returned home from university, where the university insurance is no longer covering them, their university's medical insurance program is no longer covering them, I can reapply for my dependent who was covered on my insurance as a dependent, effective January 1.
Yeah, as long as they're under age 26. Yeah,
correct. Okay. Thank you.
Sure.
A question for dental. Now, I have two questions. The first one is dental, quick one. Now, currently I have my dental. I'm a retiree, both my wife and I'm a LACER retiree, okay? And can I continue to have my dental? Now, currently I'm under my wife's because my medical is under my wife's, but I have dental from LACERS. My wife's plan is a lot better because she works longer. for the county. So can I still have my dental insurance?
Yeah, you can have your medical through your wife, through the County of Los Angeles. And if you want to just have your dental with LACERS, that's okay. You don't have to have both medical and dental.
Okay, another question is, can I cover my wife also for dental so that we have double coverage?
You can cover your wife in our dental plan. Just know that your subsidy does not cover a dependent, so that is paid fully out of pocket.
Yes,
And then what plan does she have with the county?
she has,
I'm going to retire soon. So from next month, I will have new insurance under, at this time, I select United Healthcare Advantage, Medicare with Medicare Part A and B.
I'm sorry, but for dental, what do you have? Do you have dental coverage with the county?
Yes, well, as of currently, I have Delta Dental PPO, but after I retire, my new plan will have the Cigna Dental.
Okay. I think it'll be okay as long as they're different carriers. I don't know if Margaret or if another LACERS person might have a little bit more information about that. I think there's trouble if you're double enrolled with the same carrier, that could cause some problems. But if you're with a different carrier, two different carriers, I don't think there's a real issue.
okay, I understand. Now, another question, yeah. Another question is, because my wife is retiring this year, and she has a lot of sick pay and everything, that bump our income this year to a higher level, and we end up would have to pay like $600 combined instead of under the bracket. So would that be only for 1 year? Now I understand that next year, 2021, when I pay tax, 2021 tax would be depending on 2019 income. So the 2021 income would affect the 2023 that year, right?
You're talking about
So,
Medicare, right?
So I'm talking about Medicare now, not the dental. Now, would that be an annual thing? So let's say I have to pay next year $600 per person for maybe the whole year. Would that go back to like 400 for both of us?
So are you talking about the Medicare Part B premium?
Yes.
Yeah, so it's based on your annual income. I'm pretty sure it's I think it's from 2 years ago, right? So if you're looking at the 2021 premium, it's based on 2019 income. So every year it gets reassessed based on what your income was 2 years prior. Also, sometimes you can, I think there's certain exceptions where they can remove IRMAs if there's a certain situation. I'm not sure what they are exactly, honestly, but definitely your annual income from 2 years ago will impact the amount. But if it changes year to year, there's the potential that your premium could change year to year as well. And I did want to note that our dental account managers on this call. And so she sent a note saying that if you're in the county's dental PPO plan and the LACERS dental PPO plan, you can do that. You can be enrolled in both.
Oh, good.
Thank you.
Thank you. May
Yeah.
I know what will be the premium for dental PPO plan from LACER next year?
I don't have it right in front of me actually, but it's about $50 a month. So the retired member, if they get the maximum subsidy, that will cover about $45 of that. So there will be a slight deduction, and then he'll have to pay for your full premium. So it'll be around a $55 monthly deduction for the both of you.
Okay, thank you.
And I have a question regarding the referrals, because I think I heard you say earlier that it's a possibility that you may have to get referrals from your primary provider. Because the problem that I'm having right now, I have PPO, and even just get a mammogram, colonoscopy, I have to go through this long stretch to get a referral. Then it comes back, oh, you didn't need one. So do you think that that's probably going to be handled a little bit better since Anthem, everything goes to them? Or would you still have to go to your provider and then get the referral to get like a mammogram or colonoscopy? You know, to me, that's like such a waste of money, because you're paying the provider just to say
Beverly,
yay or nay.
Are
And
you
then,
in the Med Sup plan or the pre-65 retiree PPO?
oh, I'm past 65, so I gotta.
Yeah, honestly, I don't even know where there's, so some specialists require referrals, but not through Anthem. It would be like, if I had a cardiologist, what they want to, they're busy and they want to make sure, you know, to weed out, to say the hypochondriacs, but to make sure there's a legitimate problem to see them. So absolutely not for your mammogram or colonoscopy. But with the Anthem Medicare Preferred PPO, there are no referrals needed from Anthem. Once again, your GI doctor or your cardiologist may want a referral from your primary, but that's just them telling the specialist what an issue may be, but nothing with Anthem does not require it.
Oh, okay.
Was saying was there may be some prior authorizations, and that's pretty much for every Medicare Advantage plan. We want to make sure that medical necessity and that the right treatment plan has been done first, and that they're not going straight to a surgery when there might be alternatives that are available that are better for your health.
Oh, okay, maybe I may have been confusing that from prior authorization. And that, because I said, this is like the biggest headache, because they've already sent me this little letter. You're due for this, you're due for that, you know. And then when you're trying to make the appointment, I was like, well, why in the heck do I have to see you? Well, like I said, in my mind, it's like, okay, now I have to go in and see you. That's extra money. I mean, you know, as far as I'm concerned with the insurance, because they do bill them, and then boom, then I can go make an appointment.
Yeah, if you have that problem, please feel free to call our
okay.
Because yeah, definitely no referrals, and especially for your mammogram or colonoscopy, absolutely not.
Okay, yeah, I tell you, it took, I was like, after I went in there, then it went 2 weeks. I was like, okay, you know, and I haven't even had it done yet because they irritated me. So
sorry about that.
Oh, but thank you.
Thanks, Beverly. Hi, by the way.
Great. And we have a question from Mark Miadovsky.
Yeah, this is a good question. This is a hard one to explain for a lot of people, but okay, I'm going to do my best. So the question is, I'll just go ahead and ask it if you don't mind, Mark. You want me to explain how the dependent subsidy works when you, the retiree, is in a Medicare plan and the dependent is in a non-Medicare plan. And you mentioned in your chat, like what we mean by saying that the subsidy for the dependent stays the same, you know, depending on the plan that you're in. So it's a little complicated, but I'm going to do my best. So you kind of have to play like imaginary situation a little bit. So let's say you're in Kaiser HMO right now, you and your dependent. And you are now going to enroll in the Kaiser Senior Advantage Plan. So, and you have Medicare Part A and B. So when you have Medicare Part A and B, the subsidy formula changes. So if you have 10 to 14 years of service, your subsidy for the retiree is now going to be 75% of the one-party premium of the plan you're enrolled in. Again, that's with 10 to 14 years. With 15 to 19 years, you get 90% of that one-party premium. And if 20 or more years, you get the the full amount, the 100% of the one-party premium. So again, that's for the retiree only. So what then is there for the dependent, right? So this is where it gets a little tricky. So you just have to pretend that you go back and you're in the Kaiser HMO plan again. And based on your years of service, you know, how much, when you're in the HMO plan, then, you know, how much of the subsidy goes toward you, which is pretty much like the one party rate. So you deduct that one party rate from the subsidy that you're entitled to. And then whatever's left over is the amount that's available to your dependent. And so that amount gets applied to your dependent when you're in the Kaiser Senior Advantage plan and your dependent isn't. Or in general, just in general, when you're in the Kaiser Senior Advantage plan, that's how much is going to be applied towards your dependent if you're in Kaiser. Now, if you're in SCAN or United Healthcare, the associated plan is the Anthem HMO plan. So you would imagine that you're now in the Anthem HMO plan, you look at your subsidy amount, and then you deduct the one-party premium. This is to give you a pretty close estimate. There might be $1 or a few cents difference or something like that. But again, you look at your subsidy, how much you're entitled to, subtract the one-party premium for the Anthem HMO plan, and whatever's left over is how much is available for your dependent. So that's if you're in the United Healthcare or SCAN plan, and your dependent is either in those plans with you or under 65 and in the Anthem HMO plan. And if you're going to be in the Anthem Medicare Preferred PPO plan, you imagine that you're in the Anthem PPO plan, the regular PPO plan. Again, look at your subsidy, subtract the one-party premium from that subsidy amount, and then whatever is left over is what can be applied for your dependents coverage. And I see a note from Margaret who says that she contacted another LACERS staff member, V Duong, who will send you a little worksheet that we have that you can use to help determine what that will be. And again, we are always here to help you. So if you have any questions about anything, please give us a call or email us. So you can reach us at, I'm blanking right now, is it 800-779-8328. And, or you can email us at lacers.health@lacers.org. Also, lots of great information on our website. You can go to www.lacers.org and then go to the retiree page and click on open enrollment. And there's all kinds of information. Also, attend the virtual meetings that we have with each carrier that you're interested in, or if you just want to learn more about what they're offering, please feel free to attend those just to be more informed. You know, again, we're here to serve you. Also, on a personal note, I just want to say that I will be retiring in a couple months, actually literally in 2 months. And so, you know, I've been in this position for over a decade, and it's been a real pleasure and a real privilege to serve all of you. Thank you all. Have a wonderful day. And again, call us if you have any concerns or questions.